To make your sample collection as easy as possible, ensure you drink at least 2 large glasses of water 30 minutes prior to collecting your sample. Gravity helps your blood flow, so lay out your sample collection kit on a low table so you can stand and have your hand below your elbow. Read the instructions provided to ensure you fully understand how the test should be performed. Ensure all contents of the kit are laid out and ready for when you prick your finger. Open the blood collection tube by twisting off the lid and stand the tube upright in the holder on the clamshell. Wash your hands with soap and warm water. Then soak your non-dominant hand in warm water for 4 to 5 minutes. Swing your non-dominant arm around in a circle for 10 times, fully extend if possible. Then clench your fist 10 times. This will help stimulate blood flow. Your ring finger is usually best for sample collection. Wipe your finger with the alcohol swab provided. Ensure your finger is completely dry, as blood will not form a drop on a moist finger. Remain standing and place your whole hand on a hard surface with your palm facing up. A hard surface is important so the lancet can work properly. Press the lancet firmly against the side of your fingertip until the lancet releases. Wipe away the first drop of blood with the sterile wipe. Massage your hand in a downward motion to guide the blood towards the tube. Do not squeeze too hard or too close to where you pricked your finger. You should stop about here. By squeezing too hard or too close to the puncture, this can damage your blood cells and potentially the laboratory will be unable to test your sample. If it takes more than 2 minutes to fill the tube, re-warm your hand for 4 to 5 minutes, do some light exercises and re-prick a different finger with a new sterile lancet. Once the tube is filled to the top mark, wipe your finger with a sterile wipe, wash and dry your hands and apply the plaster. Place the cap on the tube and press until you hear a click. Gently invert the tube at least 10 times but do not shake. Place the blood collection tube into the clamshell and seal. Place the clamshell into the pathoseal bag and seal by removing the metallic metal strip. Insert the sealed pathoseal bag into the box and place the box into the large UN3373 returns envelope. Seal the envelope by removing the metallic strip. Ensure you register your sample. If your sample is not registered, it will not be tested. Return your sample using the prepaid envelope provided. Samples should be posted before noon on the same day that you collect your sample.